I was always interested in mental health and people, working with people. It was always a passion of mine. The role I play in my team would be really engaging with the patients. So instead of them just kind of coming here and it be us treating them, it's a lot of getting them engaged in their own treatment and care. So, helping them to engage in day-to-day activities. I think the most common things that we do are really working with people on developing kind of social skills, reducing social isolation. We do a lot of group activities, but we always try and make time for one-to-ones because there's always those people that need the one-to-ones. Time is always our barrier, so we try and do basically what the patients need.
And then you put your ring finger or your baby finger that's it.
We started the music program on the unit because there's so many people with a common interest of music, and it's used so widely as a coping skill and to express ourselves. We consider, the environment, the other people in the group, the activity itself. There's so many considerations that go into when we're planning a specific intervention for someone to tailor make it for them that is unique to therapeutic recreation. So the difference between a drop-in recreation group and therapeutic recreations, we really meet people where they are. And not everyone has the ability of doing that because a lot of the community programs are structured a certain way to meet the needs of the general population. So within therapeutic recreation, we have the opportunity to develop that relationship with the client one-to-one through our assessment or through our screens and rapport building. And that relationship makes a big difference.
There's a particular need around summer options and exploring programming and camps for kids who may need to fill their days for the couple of months in the summer. We decided to embark on an adapted sports and recreation fair. So as you would have seen at the fair, we had a number of adapted bikes. So there's lots of adapted bikes that are available to support children who may not be able to ride a typical two-wheeler. So they have varying levels of support. So by introducing a piece of equipment like the Hippocamp, which is an all-terrain wheelchair, families then have freedom of choice. We can now go to the beach, we can go in the water, we can go on a trail, we can go to the playground, which really changes the way families can participate in recreation together. Our role is to make sure that that piece of equipment is really matched to their individual needs. So we would do an assessment to make sure that what they're using matches their functional abilities, their strengths, and their needs. I think a recreation therapist is very skilled in looking at the whole person, looking at the strengths of an individual and their family, looking at their values, and incorporating all of those things into making recommendations that make sense for their individual leisure pursuits or their family's recreation, but also really looking at the strengths of an individual, which is what I feel we do very, very well in terms of what is this person bringing with them that we can further tap into and ensure that they're leading an optimal leisure lifestyle, which is going to lead to quality of life for them and their family.
So as part of my work, clients tell me often that their social relationships change after an acquired brain injury. So one of the things that is a part of my role is helping people reconnect in social groups.
29. No. 30.
Part of it is knowing what people's likes and what they enjoy doing, and then matching people up by those activities and a little bit by who they are and if they might connect. They come and play crib. They've connected socially, they're friends. I'm not part of it anymore, and that's really what my job is.
It's just really important for our recovery. I mean, that's to get out and be able to talk to people that are in the same boat. And that's really important.
Gives me time out by myself, go play around, and I enjoy playing group.
It's just nice to be around different people.
I really look forward to coming here just because, it's a day out.
Recreation therapy is about who that person is, right? What they value in their day-to-day life and what supports they need to make that happen. At the end of the day, that's it. Most people walking by would just see a bunch of guys playing crib, right? They don't see all the skills and work that went into those guys actually getting here to play crib.
29.
And the role of the rec therapist is to help people build those skills and strengths to have so that they can engage in opportunities like this.
Recreation therapy allows people to take the skills that they're working on and practicing and apply them in a real life sort of way. Rather than just doing silly exercises over and again, you can actually try and work on something that interests you.
Patients come to us with these various wants and needs, and we are so fortunate to have recreation therapy because they can spend either individualized time with our patients or involve them in group activities.
I have been absolutely amazed at the work that rec therapy has been able to do on a neurology unit and how much support they've been able to provide the patients, the families, and the team.
In the hospital, we like to say that we're family and patient and family centered. I think that having a rec therapist on the floor involved in our team assists us in really staying true to that ideal.
I think in nursing, we're always looking at the physical environment and physical care and how can we make somebody feel better physically. I think with recreation therapy, we're looking at quality of life.
So the amazing thing that the recreation therapists bring to the inpatient acute care unit is the ability to assess a patient in terms of observing what they are, how they are behaving.
I could say the obvious benefit of having a recreation therapist on our team is the fun. I think recreation therapists bring the fun out in the team and in our patients and families.
Knowing what we have to offer, specifically the recreation therapy services that we offer here, is quite beneficial.
It's an important thing for the public to understand that recreation therapy is a service available to meet their care needs.
I think sometimes that people come and it's a bit of a surprise, but not everybody understands how a rec therapist can help. And so I think it would be helpful for everyone to know what rec therapy can do for them.
They are trained professionals who will help you gain back that quality of life that you're either missing while you're in hospital or may miss out on once you're discharged from hospital.
I find a lot of my day and my job is responding to patient needs and what that looks like. So if someone is having some behavioral challenges based on their brain injury, then that's where our focus will go for that day, to try and figure out how we can better support that person. So I use a lot of the information from a physiotherapist, an occupational therapist, or a social worker, or the medical team to make sure that I know that when I offer something to someone, I have it set up that they can complete it successfully. Because all kinds of people are looking at things differently and trying to figure out what people can and can't do. I need to know what they can't do to ensure that when I give it to them to do, they're going to have some success. Sometimes my first question to people, if they're able to communicate with me with verbal language, I'll ask them, have you ever heard of recreation therapy before? And some of them will kind of like, yeah, but it's kind of like they don't really want to say that they don't know. But I think it's okay, and it's an opportunity for them to learn. So I would explain that recreation therapy is really a process of understanding a person, and we're asking people to do things specifically for a therapeutic reason, not just for the sake of doing it sometimes. I think the public becoming more aware of what rec therapy is really important, that we are a healthcare provider that are qualified to do this. And I think the more people know, the more people can ask about it and encourage it to be a part of their healthcare team.
Well, a recreation therapist in the acute care setting, I wear a lot of different hats. So as a recreation therapist, I go in, assess all the patients that are sent to me by referral, and determine their appropriateness for the therapy, and also set the goals and set the intervention plans. So it's kind of taking smaller steps and finding new ways of how to give them that same feeling that their chosen leisure interests give them. So in particular, we have one stroke patient right now who identified painting as an area of interest. She is experiencing very limited movement in her arm. So in that case, I work with the care team on how to adapt that, because it's still something she can very much do. It might just look a little different. So I do think that it's important to be educating the population about not only the importance of recreation and leisure in general, but that there are people specialized in this. Seeing someone reach high enough to make that paint stroke to the top of the paper when they were only able to reach the bottom after a lot of work, it's amazing to go through that with them and be part of their experience here. And being able to make them smile, make them laugh, and even just sometimes cry with the little things that we can help them do is, it's the reason why we do this job. It's really important to see the whole person, and I think a person is often defined by what they choose to do in their free time, not always what they do for a job or for anyone else. It's really what motivates them, what keeps them going.